With that, I'd like to welcome everyone to the Quality of Life session. This session will introduce you to programs and services that are aiding in building community resilience for rural housing, education, rural e-connectivity, mental health, and the overall health of the underserved as we address COVID-19 challenges and disparities. We have a full panel of presenters for this session as well. Hopefully we'll get an opportunity for some questions, but I encourage you to put your questions in the chat so that if we don't get them addressed during this session, that we can follow up and get those addressed following this session. To start our presentation today, we have talking about rural housing resilience. We have Cheryl Ivey, who is the Single Family Housing Director, Program Director there at USDA Rural Development.
Good afternoon, everyone. I'm Cheryl Ivey with the Single Family Housing Division with Rural Development. I'm also the acting program director for multifamily housing. The first thing I would like you to know is that rural development is open for business. And I will give an overview of our programs and our responses to COVID-19. I did post 2 links into the chat session. The www.rd.usda.gov. If you will click on that, then you will see our website that is available. And the link right below that is a synopsis of all of our COVID-19 responses for every program that we offer. So those are available for your ready reference in case we're not able to talk about all of the details. Rural development is, we can build a community from the ground up, even though my area of responsibility lies with single family housing. We worked hand in hand with other program areas such as our community facilities program, water and waste program, B&I program, in order to serve the needs of the community. But we ramped things up a bit with the COVID-19 pandemic because we're concerned about our communities and concerned about our customers and their well-being as well, as you all have so aptly recognized with your quality of life session here today. Just a bit about our structure. We're based out of the Little Rock office where the program directors are housed. Tim Smith is the director for B&I, Business and Industry, and he's also the acting director at this time for Community Facilities and Water and Waste. So if you will contact our main line, majority of the time we are working off site due to the pandemic. However, we are able to respond timely because we do receive our emails, our voice messages through emails, and provide an immediate response when we are contacted. But for the direct questions that we have related to the pandemic, we make loans for single family housing people, customers to purchase or build new and existing homes. And in response to our current customers, we're able to provide relief and peace of mind when it comes to actually making their payments through moratoriums, which means that we can delay payments for a period of time up to 6 months, even up to 2 years with proper application and documentation. We also suspended our foreclosures. So if people were already struggling and were not able to meet their payments, we're not going to foreclose on anyone that occupy their dwelling at this time, nor are we going to begin any new foreclosure actions if people are struggling. So that should provide some peace of mind for them until we can get the COVID-19 under control and people back to work. And we also consider the fact that when people are applying for loans, they may be laid off or not able to know exactly when they're going back to work, or if they're going to have unemployment or anything. So we're extending our eligibility determinations that have been made, waiting for the customers to hear if they're going to be called back to work and when, and what their salaries are going to be. So we're trying to be very flexible in all of our rules and regulations in all programs, and we want to provide comfort and peace of mind that to our customers, whether you're a business or a tenant in a multifamily complex or a borrower with us on the housing program, that we are here to support you and provide all flexibilities and power of the Department of Agriculture in order to ensure that we're all successful in our rural areas. So I'll talk a little bit about multifamily, our borrowers, and they are our customers as well. So we do have relief if they're having difficulty meeting their payments on those complexes. And our relief extends to the tenants. They are not able to be evicted by the management companies or the borrowers during this time. So there are lots of things that we can do to provide relief. And you can click on the link that I provided that will give you can print the ready reference that is available that will go into more detail on all the things that we have to offer. I want to let you know that we are reachable. If you will email me, or I'm not sure about that telephone number that's there. That's not correct. My main line is 501-301-3235. I have someone monitoring the telephone lines. You can call that number. My direct line that rings on my desk is 501-301-3237. And if you leave a message, I monitor my calls because I receive an email with the message, and I will immediately call you back. Or you can reach me at the email address shown on the slide. But to talk a little bit about our structure, we have 6 area offices, and each area office has an area director that is responsible for all programs in their area. You should be able to find contact information for each area director that's responsible for 10 to 12 counties. And so you can either contact me, or you can look on the website to find the area director that is responsible for all programs in the county in which you live. So with that, I think I've reached my limit there, Mr. Rainey. And I appreciate the opportunity to speak on behalf of rural development, and we appreciate our state director, Mr. Branscombe, who was on in the opening session, for the opportunity as well.
Thank you, Ms. Ivy, for that session. If you would type that correct phone number into the chat to allow the participants to be able to capture that if they missed that as you announced it. But we're going to go ahead and move to our next session, but definitely appreciate of that. Our next session is looking at education challenges and disparities as a result of the pandemic, where we have Don Benton, who is Assistant Commissioner of Research and Technology. Don?
Hey, thank you guys for allowing me to speak today. We've been doing a lot of work in the Department of Education trying to prepare schools for the COVID pandemic. And as you all know, the past spring was very eye-opening for us. We recognized many challenges that schools were dealing with in the form of blended and digital learning. Fortunately for us as a state, we were a little bit ahead of the curve compared to some states with regard to alternative methods of instruction. We had legislation passed back in 2017 that allowed schools to use alternative methods of instruction for school closures, whether it be a flu pandemic or, flu being rampant in schools or whatnot. And we were trying to, when that legislation was passed, it was basically a way to help schools have to make up days at the end of the year where they could continue education throughout those minor closures. Well, when COVID hit, it changed the game considerably for us. One of the biggest things we learned is there were a lot of gaps. And we have performed, and I'll put a link to this in just a few seconds. We performed a blended learning needs assessment. I deal mostly with the technology and education in the schools from my department or from my division. And we pulled data together to find out what schools were capable of doing and what they were planning to do for the fall. The link I shared with you right above Miss Ivy's link that she just posted, or information she posted, is to our Arkansas Ready for Learning initiative. Commissioner Key and the governor pushed for this initiative to make sure that we were giving our schools proper guidance in light of the situation that we're in. So what's interesting is we've learned a lot of our schools are doing a terrific job in preparing for this, but some of our schools need additional supports and additional help. And so we're trying to make sure that we meet their needs, because we are in the game to educate all students, no matter where they come from, no matter what their socioeconomic status is or what their learning barriers are. We want to make sure that we're meeting the needs as best we can. So we put a lot of flexibility into our Arkansas Ready for Learning plan. We want to make sure that schools know that they're going to have supports where they need them. And we know that there are still so many unknowns that are going on right now with preparation. We meet with our technology directors around the state weekly. We meet with all the co-op directors weekly, sometimes more than, well, those guys, we meet with them twice a week. And then we meet with the superintendents weekly to talk about issues and concerns and guidance. We are also trying to help them implement practices that allow them to spend the CARES Act funding appropriately. So there are a lot of moving parts to what we're doing right now. We're also working with Clint Moore, who I believe is on this session, with some initiatives that will hopefully assist schools with connectivity for our students, especially those who are disadvantaged or who are in areas where they might have a little bit more of a struggle getting connectivity. We're working on some initiatives, and hopefully some news will be coming out about that pretty soon. I shared a link also that has our blended learning readiness information, our data in our product called LEA Insights. So you can look at it at the district level or the co-op level, so you can see where some of the gaps are. What we've learned the biggest thing that we're hearing, excuse me, is that schools need connectivity. Let me rephrase that. Schools have connectivity, or students need connectivity. So we've been working really hard to make sure that we're planning for that. A lot of our schools are ahead of the game on this, but there are many areas in our state, and Clint may delve into this a little bit more. There are many areas that there's just no connectivity. And so a blended learning approach truly is going to have to be blended. In saying that we're trying to be very clear that blended learning does not mean necessarily online learning. Blended learning takes into consideration a lot of things. For example, you have to consider the kids who can or have access to online opportunities, and you have to really consider those who do not. So we're looking at different opportunities, and we have different supports in place. We have an organization called Team Digital, and I will share their link as well. Team Digital is one of the organizations under my division, where we help schools implement and strategize on how they're going to do blended learning for the fall. They've been together for several years now. They're a grant-funded organization, and they're working in partnership with our Virtual Arkansas and Arkansas Public School Resource Center and the Office of Innovation and Education to help teachers and educators and families be more prepared for what's coming this fall. Once again, we don't know exactly what the first day of school is looking like. The plan is for everyone to be on site, but we know that that's out of our control to a degree based on how the pandemic progresses. So we're trying to anticipate things, and we're working through what if scenarios to see what we can do to offer better supports for our schools and for our families. There are still going to be gaps, and there are still going to be barriers that we're going to have to overcome. One of the things I've been telling everyone that I've talked to this year with regard to teachers is, even if you're a 30-year veteran teacher or a 1-year, first-year brand new teacher out of the chute, this year we're all going to be first-year teachers. We're going to learn a lot of new things. We're going to learn how to innovate and create but we're going to continue to educate our kids the best we can. Now, saying that to say, we understand that there are still going to be some unknowns happen to us, and we're going to do our best to prepare for us. But I think as a result of the result of the pandemic, if I try to look at the cup as half full, we're going to learn many strategies and many innovative processes that are really going to help us educate our kids better and to teach better. We are already having conversations that have really changed the game with how we utilize technology. And one of the things I also think about is technology at one time was that luxury or that other thing that we pulled out of the box whenever we needed it. Well, now we understand that technology is going to be a huge driver in what we do for educating our kids and working with our teachers in the near future. And not knowing how long the pandemic is going to be so bothersome to us, we've really got to plan for this and for the long term. And so we're not trying to look at a 1 month, 2 month, 3 month fix. We're trying to look at a long-term ability for us to continue education the best we can. But we also know that some of our plans change, and we have to be very fluid, especially with our guidance and with our directives and with some of the laws that are in place where we have waivers. And we're very fortunate to have Commissioner Key and Dr. Pfeffer and the governor working side by side with all these other organizations. Department of Health, we've been working with them daily on making sure we're giving out proper COVID guidance for our schools. So there's so many things going on right now. Probably the busiest or the most challenging season in my entire 26 education career has started March 12th when things just started going crazy. But we've learned a lot. We've learned mostly about our resiliency and our educators and our students. Our students are amazing with what they're able to do with so little. And we're trying to do the best we can to make sure we prepare our kids and prepare our teachers for this fall. I thank you guys for giving me a chance to speak. I hope I didn't go over my time limit or my time allotment here. And I'm available for questions. That is my correct email address, and that is my correct phone number in the information slide. And I appreciate any questions or any comments from you guys. And I can share other resources if you need those. I appreciate you very much.
Great. Thank you, Don, for that presentation. Very informative and some exciting things going to meet these enormous challenges that we have. Next up, we're just going to go right on. And if we have time, we'll save some questions at the end. We'll move to the topic of federal broadband programs, where we have William Vogt, who is USDA Rural Development Telecommunications General Field Representative. Mr. Vogt.
Hello, good afternoon. I'm speaking about a couple of things, broadband and also distance learning telemedicine, which as we get into our times these days become very important because you need connectivity, education's important, medical care is important. And so I have some existing programs that I want to tell you about that deal with those and that can perhaps interest you or perhaps apply to what you're doing. We have some existing programs that have been around. We've got a program under our electric side of the RUS agency, and it furnishes loans to electric cooperatives, and those loans can build fiber systems to do what's called smart metering. So the electric co-op can build out to a meter, and they can do load management and other things. Oh, and by the way, as long as that fiber's out there, they could offer broadband service to their customers. So we have a loan program on the electric side that can allow an electric co-op to build fiber. Similarly, with the regulated telephone companies, we have a loan program for rural independent telephone companies that can achieve a loan to them to build fiber to the home. And that loan program continues each year. It's about $690 million we've got per year, first come, first served, in a loan program for rural independent telephone companies. If you don't happen to be a rural independent telephone company or an electric co-op, we have two other programs. We've got a loan program under the Farm Bill that allows for loans to build in those areas. It could be the applicant is the electric co-op or the telephone company, or it could be others that want to build in rural areas. Technology neutral. It can be fiber, it can be coax, it can be wireless. It builds in rural areas. And that program under the Farm Bill continues. Right now it's got $100 million, but more would be in the next appropriations for that as well. Along with that, others that aren't electric co-ops or telephone companies, or including electric and telephone, we have a Reconnect program that was presented under the 2018 appropriations bill. And it allows for funding in rural areas. It's loans and grants and combinations of loans and grants to build into rural areas. Both the Farm Bill program and that program require that the applicant be an entity that is established and that is in the business or has experience in providing broadband service. Also, under the Farm Bill, we have a smaller program, and it's a grant program for areas that have no service by any provider whatsoever at a speed of 10 by 1, one single area. It's called the Community Connect Grant Program. And in that, the applicant can be just about anybody, including a startup company. So the only ones that we don't reach by those loans and grants would be individuals that are wanting a connection for internet or something like that. Otherwise, the applicant would be the entity that is furnishing rural broadband service. So those are the programs. What have we done with those programs? Well, here's some things that have been done recently with those programs. Recently, in the past couple of weeks, the electric program made an announcement in Arkansas that there are loan funds going for rural broadband under the Smart Grid program to electric co-ops. Also, just a few weeks ago in the telephone loan program, we announced a loan to Southwest Arkansas Rural Telephone Company, cooperative in Texarkana, to complete their build out of rural areas. In fact, they had a bid opening last week for the first part of that construction. So we continue to build under that program, as we do with other loans. Under the Farm Bill program, it's been a couple years ago, but we're still continuing to build a loan around the Camden, Arkansas area. Arkansas Rural Internet Services is building an area all around Camden, and they continue to just build that every day. And so that's an ongoing thing that is taking place under the Farm Bill program. Under the Reconnect program, we had 2 awards last year in Arkansas. Those awards, along with all the others, have gone through the legal paperwork and the environmental to get the funds available. And the fun part about that is one of those awards is ready to go. And I've just received this week the first contract, get it to Washington. And as soon as we can, perhaps in the next week or so, that project will be under construction under our Reconnect program. The Community Connect program hasn't had any awards. It's a very small program, $37 million nationwide, and there haven't been awards in Arkansas for the past couple of years under that program. Now, what are we about to do with those programs? Well, the programs continue. The electric program is a ongoing thing, first come, first served. Same thing with the telecom program, first come, first served. Under Farm Bill, there was a revised regulation issued May the 11th, and we look for a window for applications, perhaps the last quarter of the current calendar year. The Reconnect program had a second round that closed in April, and we're currently underway reviewing those applications, and we're wanting to get announcements out as soon as possible. So stay tuned for some announcements under Reconnect Round 2. Under Community Connect, that was under the Farm Bill. It's going to take some IT changes. We're looking for an application window to be open at the very end of the calendar year, the last quarter of the calendar year. And so that one will be underway as well. So that's what's happening with broadband. Also exciting news in distance learning telemedicine. We have a grant program. The grant program for years had been $25 million a year, and then it was $40 million, and then it was $60 million, and last year it was $71 million plus another $25 million added under the CARES Act. The $71 million application window closed in April. Those applications are currently under review, and we are working towards getting those announcements out. The second round, which was under the CARES Act, $25 million, had an application window just ended July the 13th. And so those applications are just now being received, and those will be evaluated, and we want to get those processed as well. The prior year money, we've got those all out. The awards from a year ago have all been released or are under construction, a couple of them in Arkansas. So we've got good things happening there. So the news is, yes, there are areas, and we desperately need broadband. We desperately need distance learning. We desperately need telemedicine. And there are programs that will address those things. One of the things we need is applicants. We need to have interest on broadband providers in order to enter into the program. I'm glad that Clint is following me, because the state of Arkansas has some money that can work in conjunction with our money, maybe to get us there in those endeavors. We need to get the word out there that there is money available for those providers that wish to apply. I'd be happy to talk to anybody about that. And in the loan programs, I can work with the applicants. In the grant program, it's competitive, but I can give general information on that. We also need to keep the word out there with distance learning telemedicine, because the need is still there, and we need to get people interested, because Arkansas always does well in the scoring. It's a competitive program, but it's based on rurality. It's based on some other factors, and Arkansas does well with that. So I've been watching the clock in the corner of my computer, and I've got maybe about 20 seconds that I'm going to yield to the panel now. And my contact information is correct. It's on the screen. And if anyone's got questions or follow-up, please get hold of me. I'd be happy to talk to you about the programs and let you know what's happening. You can find out all the information at rd.usda.gov. If you click in the contact screen, you can even subscribe for updates in the programs. And I just saw it was 10 minutes, so I can't yield the 20 seconds. My time is up.
Well, thank you, Mr. Vogt. Really excited to hear about those programs. And I think Mr. Clint Moore from Arkansas Economic Development Commission is going to go a little bit more in depth on some of the Arkansas broadband programs. So Clint, we'll turn it over to you.
Yeah, thank you, Ron, and just want to appreciate y'all having me on today. It's always a good day for me when I get to share the exciting stuff that the governor's office is doing in terms of broadband. As many of you know, across the state, this is something that we really struggle in Arkansas. It's not something that we do well, which is why it's so exciting that the governor's office and the General Assembly are starting to put funding to this, starting to pass legislation in the broadband space, and really and try to get Arkansas's digital divide closed. So when we talk about broadband, I really feel like it's just as important as clean water. It's an interstate highway. It's electricity. We have to have this for Arkansas to be competitive in today's economy, in today's workforce, in today's education, and in today's medicine. Broadband is much more than quality of life. I feel like I know the vast majority of people use it to watch Netflix, or kids to play video games, or whatever it is. But it's so crucial for us as a state to really expand the broadband footprint out into rural Arkansas. So when you look at where we are compared to other states, Arkansas ranks 50th out of 50th in connectivity. Part of that's because we're a very rural state. Part of that is because we have mountains and some really difficult obstacles to overcome in terms of landscape. But that's why it's so important for us to work with people like Mr. Vogt and even put state dollars to work as well to try to close this. I think the COVID pandemic is really an eye-opener for a lot of people, policymakers, as well as just residents in Arkansas of how poorly connected we were and how much we really need to focus on broadband. So when you look at it across the state, it's exacerbated in rural areas. It's very bad, but it's also an issue in more urban areas as well. The electric co-ops in Arkansas, rural telephone companies are also going out into these really rural, hard to reach areas and making a difference in terms of broadband. they have some of the best speeds out in some of the, really deep corners and deep pockets of the state, because you've got such good private sector engagement from these kind of new players into the space. So we're really excited about some of that movement. Now, I'll talk briefly about the governor's program, and we're going to kind of hit the high points on that. But by any means, if you're interested in applying for the program or would like information, please contact me. My number and email is listed there. So the program has $25 million to distribute in grant funds. Part of that is CARES Act money, and part of that is state funding. Originally, this was supposed to be a completely state-funded program, but due to the coronavirus, the state budget kind of dwindled, and so we have these free federal dollars coming into the state that we're going to use to get broadband out before the end of the year. So we're focusing on quick deployment, and we're focusing on really trying to make an impact in these rural communities as fast as possible. So applications, we've actually made 2 awards already, and we're going to score and award those as they come in. So we're working through the pile that we have. We've had quite a few apply now, and we're hoping to see more applications in the future to score and fund. One feature of the governor's broadband program is local authorities, whether that's a county judge or city mayor, whatever it might be, have to be a co-applicant on the program with the providers themselves. So we're not expecting county judges or mayors to be experts in broadband. That's why they're co-applying with the provider. The provider has the big lift of doing the network design, billing, build out, etc. What we're really trying to do is give these rural communities kind of a seat at the table, let their voice be heard, to make sure they're getting quality service, to make sure that they're getting a fair price, to make sure they're getting good customer service. All those things that matter to consumers. The county judge and the city mayor is there to represent that and kind of bring those voices and manifest those voices to the table. So the providers, have to work with them. The locality, if you're in an area that has multiple providers, you can submit multiple applications with that provider. You can actually submit up to 3. So for example, in the state's technology neutral, we're not going to tell a locality what network is best for them, but if they wanted to apply with a fiber provider, they could. If they wanted to apply with a cable provider, they could. Or if they wanted to apply with a fixed wireless company. Whatever it is, we just ask that they keep it under 3, and then they tell us which is their most preferred application. So we're very flexible. We're letting the private companies and the locality work together to try to create a solution that makes the most sense for those areas. The application can be found on the website, which is broadband.arkansas.gov. There's a tab for Arkansas Rural Connect, and all the information is there. The areas that we're trying to target is counties, unincorporated communities, or a municipality. So we're very flexible on who can apply for the funds, as long as they are co-applying with a broadband provider that has a successful track record of deployment and that's going to provide the high-speed broadband that the governor's program requires. Now, these project footprints, the big key to them is they have to have 500 people in them. Now, that doesn't mean the one single community, if it doesn't have 500 people, can't participate. What we ask is then that community fill out an application with the broadband company, as well as another community to get it to surpass that 500 population threshold that we've set aside. And what that really is for is just to make sure that these build outs that are taking place are financially sustainable on their own. The state government's going to pay for the infrastructure and deployment, but we can't cash flow the project. Those projects need to cash flow and be sustainable long term. Now, we have a map on the website as an initially eligible kind of areas that are saying that they have poor internet service. Now, that map is more of a starting place and not the finishing point. We know that Arkansas is very poorly connected, and so we're working through issues that if you go to that map and say my community is not eligible, then by all means contact us and let's work through that, because we want everybody to apply that is interested in the program. As I mentioned as well, we're wanting these partnerships to kind of reflect the strengths of the internet provider as well as the local officials. So we're wanting the provider to do the heavy lift, and we're wanting the local official to just represent the community as they go forward. Now, I want to briefly mention the program because I see I'm kind of getting short on time here. There was a new broadband program that Mr. Vogt mentioned before me to go after federal funds. That program is called the Rural ID Trust Fund Program. There's a $2 million budget associated with that. It's a complement to the governor's program as well. So the governor's program focuses on expanding the broadband footprint out into more rural communities, rural areas across the state. And we're using, as I said, state dollars to do that. This program is designed to leverage the federal dollars that the USDA has, as well as the FCC and other funding agencies, because their pots of money are much larger than what the state has. So that $2 million program is going to get broken down into $75,000 grant. Now, a local community or a local entity, whether a county or a city, can apply for those grants. And what they do is those grants are for due diligence studies and for application costs associated with the federal programs. Occasionally, those programs are slightly difficult to get. Not all of them are, but some are, and they require a lot of time and effort to create an application for that. So that's what this program is for, to defray those costs while still getting good participation in the federal programs. Now, the rules for the Rural ID Trust Fund is still being developed, and I think there's good momentum behind that to get those out very soon. But however, there's not a date associated with that yet. So with that, Ron, I'll turn it back over to you. I will say that my email address is clint.moore@arkansas.gov, and I'll put that in the chat as well. My phone number is correct, but appreciate the time, and please reach out to me if you have any questions. I know we went through it pretty quick, but here to help, and we really want to see broadband expanded across the state. So thank you again for the time.
Thanks, Clint, and thanks for updating your email address in that chat. And again, we're going to share some of the chat questions out to the participants as well as the presentations that you're seeing with their contact information following the presentations following this day. Next, we're going to shift the focus a little bit from technology and housing over to health, and specifically overall health and then mental health. So next on our program, we have from the Southwest Arkansas Mental Health Center, Hezzine Shepard, who's a crisis counselor there, to talk about funding for mental health. So go right ahead, Ms. Shepard.
Again, my name is Hezzine. I go by Zena because most people can't pronounce my first name correct. So it's easier for them to say Zena most times. But I am a crisis counselor here for Southwest Arkansas Counseling Mental Health Center on behalf of FEMA. And so we've partnered with FEMA this year. It's my first time doing this program, so I'm kind of excited and I'm learning a lot of new things as well. But we partnered with FEMA, and the program is promoting positive emotions for Arkansas. And so what we're doing, we are reaching out to people who are in the area. I cover Miller County, Lafayette County. I have two more young ladies that work with me that cover Little River, Sevier, Howard, and Hempstead County, and then Columbia, Wichita, and Nevada County. There are 7 other mental health facilities that are partnered with FEMA as well for this program. And so what we're doing, like I said, is promoting positive emotions, because we know with COVID-19 going on, it's put everybody in a stressful situation, frustration, depression, all kind of emotions. So what we're doing is just reaching out to them, letting them know that we do have a program, and it's free and anonymous if they want to call and talk to someone on our crisis support line. And we do have those numbers available, I believe. Well, those are our social media websites right there. We basically I reach out, we make calls to businesses, churches, any local entity that we can contact, and just let them know about our program. And we drop off flyers with the information on it about the program and the resources that we do have available for them. So currently, and then plus we try to go to food banks, like pantries, when they set up, when they have those days that they set up for, like churches do the food pantries and things like that, when they're giving out those resources to the community. We try to go and set up at those to pass out this information and different things like that. So the difference and we do not diagnose anyone as a crisis counselor. We're just here for support, just to let them know, try to help them find resources and help them through their anxiety, stress, or anything like that. That's what we mainly focus on as crisis counselors. And then if they do need mental health services, we give them the resources to reach out for that. We do not try to push the mental health issue or try to push anybody into doing mental health. We just try to help them cope with the different feelings that they're having while we're in this pandemic right now. And right now we're just covering the Arkansas areas, and it's free of charge for Arkansas residencies. We have been out to some nursing facilities, different places who have, like, the workers have not had time off, haven't been able to not work and things like that. And so we know it's stressful for them because most of them want to be home to try to be safe and not be out during this time, but they can't. And then, not being able to interact with family because you're out in the public mostly and around people, and you don't know if you encountered someone who may have the COVID-19 or not. So there is different little things that, we try to get them to understand and assist them with in order to get through the depression, the anxiety, or the stress of everything that we have going on right now. And so those are our contact numbers. If anyone, if you know a family member or friend or anyone who's experiencing any of these things, because, at this point, we do not know what's going on with COVID-19. None of us know when it's going to leave here, when we're going to get through it, or how we're going to get through it, but trying to help each other maintain a healthy, positive attitude while we're going through this is probably one of the best ways we can help each other. So that's kind of how our program is set up.
Great.
And thank you, guys.
Thank you, Zena, for that information. And it's exciting to know that those resources are available because there is so much stress out there, from financial to social. So great resources. If you will, I'm going to go ahead and have our last presenter go. That way we can, if we have any remaining time, even though we're early, we'll just use that for Q&A. And we'll go to our last presentation, which is Ms. ShaRhonda Love, good friend and church member from Arkansas Minority Health Commissioner, the executive director, who will talk about some response to resilience in the health sector. Go ahead, Ms. Love.
Well, thank you for that introduction, Dr. Rainey, and thanks for the opportunity to present this afternoon to talk a little bit about the Arkansas Minority Health Commission. So the mission of the Arkansas Minority Health Commission is to ensure all minority Arkansans equitable access to preventive health care and to seek ways to promote health and prevent diseases and conditions that are prevalent among minorities. And so in essence, we provide access to preventive health screenings like blood pressure screenings, diabetes, cholesterol, and HIV/AIDS. We also provide access to health education. And so I would be remiss if I didn't take time today to explain a little bit about the coronavirus. So it is an infection that is a new coronavirus, which is contracted now from people to people. And what we know is that mild to severe symptoms include fever, cough, shortness of breath, chills, repeated shakes, muscle pain, headache, sore throat, and loss of taste and smell. We also know that those who are experiencing severe symptoms have things like trouble breathing, persistent chest pain or pressure, confusion, as well as bluish lips and face. And so those individuals need to seek immediate medical attention. So how is the coronavirus spread? It is, as I said earlier, spread from person to person, but can also be spread by touching surfaces. So just like with the flu, if you touch a door handle that someone else previously touched and left germs on it, you could potentially contract the virus that way as well. So best way to protect yourselves, next slide please, is to wash your hands and do that often. We know that when the pandemic hit, bleach and Clorox wipes went off the shelves in the store. But what we also know is soap and water kills the virus. So be sure to wash your hands for at least 20 seconds and with soap and water. If you don't have soap accessible, utilize hand sanitizer with at least 60% of alcohol. We also know that we have to socially distance, especially from those who you are not living in the same household with. So being sure to stay at least 6 feet away. Covering your mouth when you sneeze. If you use a tissue, throwing it away immediately, and being sure to, again, wash those hands for 20 seconds or more. And then if you do have to cough, making sure that you do it in your elbow or a tissue versus in your hand where you could potentially touch a surface and spread the virus. So who's at greater risk? All of us. We know that anybody can contract the COVID-19 virus. However, what we are finding is that there are some who are at greater risk for being sicker and increased death risk. So we know those that are older in age, 60 and over, those with chronic conditions like heart disease, diabetes, and lung disease. And so we also know that because minorities are disproportionately impacted by these chronic diseases, they are also the ones that we are seeing increased death rates for COVID-19. So testing and screening for COVID-19. The Department of Health is now offering testing daily at local health units. And so I put the link here in the chat earlier so that you have access to that. If you are in need of a test, experiencing symptoms, or if you have been exposed to someone, you can go to a local health unit. You can also go to your primary care physician and receive a test for COVID-19. In addition, I added the number for contact tracing in the chat, simply because I know that we sometimes are hesitant to answer phone numbers for which we are not familiar with. And so it's important to know that if you receive a phone number from 877-272-6819, that is a contact tracer trying to reach you. And it is important for us to be able to provide accurate information to them so that we can make sure that anyone who may have been exposed receives a test, and that we try to stop exposure to others. And the best way for us to do that is through contact tracing. Next slide, please. So the Arkansas Minority Health Commission has been working to make sure that we are getting outreach to the entire state as it relates to COVID. We have a COVID-19 webpage on our website at arminorityhealth.com. We are providing presentations similar to the one that I am doing here today, that we work with community-based organizations, faith-based organizations, and nonprofits. We also have access to health fact sheets that are culturally competent so that individuals will see themselves in the fact sheets. They are plain language, means they are at a 5th grade level or below, and they are in English and Spanish so that you can provide them, we provide them in the majority languages used here within our state. We also are trying to reach the state through media, television, radio, as well as social media, providing daily updates as it relates to COVID and the governor's daily briefing. I would be remiss if I didn't mention some of our traditional programs, specifically since COVID is impacting those with chronic diseases disproportionately. And so the Arkansas Minority Health Commission has access to a mobile health unit that provides preventive screenings. We travel throughout the state providing those. We also have our Southern Ain't Fried Sundays program, which is a healthy meal option that encourages us not to do what we like to do here in the South, which is fry everything. And it provides low calorie, low fat, low sodium options of traditional Southern foods. We also have our summer camps, formerly known as Camp IROC, now is Camp ICAN, and we provide it for youth, middle school age, that works on nutrition, fitness, and bullying. In addition, the Minority Health Commission has access to sponsorship and partnership dollars, where we work with community-based organizations, faith-based organizations, nonprofits, and schools to provide access to funds for health initiatives. So whether that's a health fair or a health program that you want to see done in your community or within your organization, you can apply through the Arkansas Minority Health Commission and receive funds to help support that. Next slide, please. Thank you. We publish our annual Bridge magazine, where we are able to spotlight our partners in minority health that are doing things within our state to decrease the disparities that we see, as well as provide information on minority health issues, just informing the community. So you may be asking yourself, how can I find out about this information? If you are not currently on the Arkansas Minority Health Commission listserv, you can request to be added by logging onto our website. Again, that's arminorityhealth.com, and requesting to be added to the listserv, where we share not only Minority Health Commission information, but partner organization information. And so if you had health information that you wanted to get out statewide, our listserv is a way to accomplish that. Next slide, please. We also have social media. So if you're not already, you can follow us on our social media. We are on Facebook, Instagram, and Twitter, and we post daily updates as well as monthly health campaigns to provide health education information throughout the state, reaching those where they are. And so here is my contact information. You are more than welcome to email me or call. You can also log on to our website, arminorityhealth.com, to access any of the resources that I've mentioned today. And I, again, appreciate the opportunity to present.
Thank you, Ms. Love, for that information on the number of health resources available across the state. With that, we have some time for some questions, and I'll start by first throwing it to Rachel and Russ to see if there's some pending questions in the chat area that we can just pull out fairly quickly. And this will be open to anyone in the panel. Great, and thank you all. Thanks to all the presenters, as we will join to give them a collective virtual hand of applause for their efforts. Thank you all for that great information. Look forward to seeing you in the wrap-up session.
And thanks too to Ron for being a wonderful moderator for both of the sessions today. Thanks, Ron. We appreciate it.